I'm most looking forward to working with the undergraduate pharmacy students to be able to work with them to show them things that they can't learn in the classroom, so that when they graduate they are well prepared and well equipped to do the things that are expected of them in a safe and competent and clinically confident outputs for what they're needing.
In the past, the placements were very passive because they didn't spend very much time with us. With the greater length of time they'll be spending, they'll be able to do things in much greater depth. So we will be really taking a lot more time in teaching them medicines reconciliation, clinical problem solving, and things that will put them in a much better position for their future careers.
It's different for every student. First of all, I'd like to ask them what do they want to do? What do they want out of the placement? And really tailor the placement towards them. Obviously, there will be standardization, so there will be learning long-term condition reviews. There will be patient-facing under supervision. They'll also learn how to do examinations, something different to what pharmacists usually do in their environment. So again, it's up to them. The eager they are, the more we teach.
We were part of the pilot group when Health Education England introduced these longer styles of placement. So, this won't be our first rodeo. We've got all of the learning that we had from last time. So we're going to take what we've learned, what works, what doesn't. We're going to give them a variety of different experiences with a variety of different people. But the main focus will be medical wards and also surgical wards. So they will spend the morning with a clinical pharmacist and they will typically look at a new patient. They will gather some information. They will do a medicines reconciliation, and then all of the information that they've gathered they will use in the afternoon to develop their own patient case-based discussion. So they'll be looking at the bloods, the OBS, the notes, the drug charts. They might have the opportunity to speak to the patient as well if they've got any questions. And then they will build that presentation where we're quite prescriptive about what we want them to do on each slide, what content they need to cover. We give them a couple of hours of thinking space to cover that. And then towards the end of the day, one of our pharmacists will go back, listen to their presentation, clarify any learning points, and sort of ending the day on that note where they've had that experience.
With the students, I think what we'll be doing is starting with learning the dispensary, learning how to dispense, and then learning how to be more clinical with their role as a pharmacist. So understanding what the pharmacist does in terms of patient contact, in terms of being able to counsel patients, being able to respond to symptoms. New style community pharmacy is going to be the first port of call for most patients. So these students are going to be able to come in and start to learn how to deal with being that first healthcare professional that the students will, the pharmacist sees.